The truth about Botox is who's doing it and how are you going to get the best results. The reality is that everybody's doing Botox today for cheap. And so you've got to ask yourself, what are the qualifications of this person and why are they charging so little for a procedure that's actually quite important? The reality is this, is that you need a physician who really understands the anatomy of the face, someone who's been specifically trained in managing all the issues of your facial skeleton, your facial muscles, and your skin. And in my opinion, there's only one person who knows that, and that's a board-certified plastic surgeon. In my particular case, I've trained for 9 years in the best institutions of the country. You see, it's not so much the injection itself, because that's easy. It's where to inject, and you need to know how to do that. Plastic surgeons, they're going to be charging about $15 per unit instead of 8 or 10, and they know where to inject. And how does it really work? How does Botox work? Very simply, you inject very, very small amounts of the Botox, maybe about 2 or 4 units each time, into the actual muscles that create that wrinkle. The wrinkle between the eyes, in the forehead, or on the side of the eyes. It's going to take about a week for it to take effect, and usually lasts about 3 months. But I've actually seen patients that have had the Botox last much longer than that. The procedure itself takes about 5 or 10 minutes. There's really no bruising. The discomfort is kind of minimal. Some people just don't like the crunchiness that you get sometimes, but it's really a very easy process, and the results are quite remarkable when it's done correctly. Occasionally you may find some droopiness. I rarely ever see that. What's really nice is that those wrinkles actually do go away. Some of my patients then ask me, what about Restylane? Should I use Restylane instead? Here's the deal. Botox, very specifically, is for the active wrinkles, the wrinkles that are created by the muscles. Restylane is something for the passive or deep wrinkles. You don't want to mix the two. Once again, make sure you go to a board-certified plastic surgeon who is very qualified in performing these procedures, and make sure that you do look at the bottle called Botox Cosmetic. That's the one that's the official FDA approved for this process. So enjoy the changes that you seek.